Good day, wonderful people. So today I want to give a little tips on how to make the best IV experience, because it's going to hurt, so I won't lie to you, but I'm going to show the anatomy of why it hurts and how you can kind of decrease that pain. But first I want to talk on an experience I had when going to the hospital with one of my relatives. And I think as a nurse, we're kind of blinded to the perception of our patients, especially like if it's not communicated. So when we put in IVs, one thing that we don't remember to reinforce and educate is that there is no needle in your arm. And let me tell you what I mean by that. So you're not crazy when you get an IV. Yes, there is a needle that goes in your arm, but it does not stay there. What you're experiencing is when we put the IV in the arm, there is a needle surrounded by a tube. That tube is called a catheter. So it kind of mimics a straw, so that way the fluids can go through that tube like a straw, like a water hose, to give you antibiotics or fluids or whatever the doctor may order, right? And how that works is we can't just get the straw through. It's too flexible. So the needle is inside to help break the skin to leave the catheter inside. And once it's in, boop, we press a button, it proceeds back in. That's the thing we drop and throw away. This didn't become obvious until the doctor walked in and he was telling my family member, you can bend your arm, you know. And he was like, no, I don't want to bend my arm because there's a needle in my arm. And I'm like, wow, it's so funny. Like, we don't even think about that. Like, to remind them, like, no, it's okay. You can move, you can bend your arm, and educate, our patients that it's okay, it's safe. You're not going to re-stick yourself if you move wrong. So that's what the fear is, that there's a mini knife in there, and if you move it this way, you're going to cut over there, cut over here, and cause more bleeding. No. It's a needle that goes in. The tube stays inside in order to give medications. And once that's in there, you can move about freely. However, again, it is a water hose. It's basically a catheter. So what happens when you bend the water hose? There's a little bit of fluid that may come out, or it may stop completely. So, yes, if it is in a certain spot, like in the bend of your arm, and you bend it, it's going to beep. So you may see the machine beep, beep, beeping, because it perceives, it's a machine. So it perceives that there's some type of blockage. And once you extend your arm again, make it straight, it'll stop beeping. So that's why that happens. So I just want a public service announcement that it's not a needle in your arm. You're not crazy. There was a needle to help get it in, but it's out in order for the catheter to do its job. Now, the second thing I wanted to talk about was a way you can make it as least painful as possible. You're going to have pain. However, if you consider the anatomy of where it's going, let's say let's jump to shots, for example. I do this with my school-age children and up, because of course they're freakish about shots and needles. Anybody would. There's adults who don't like needles either. Like, who does? And so what I explain to them, I give them a demonstration like this. I keep it really simple. And I keep it simple for my adults too, who's like really, really scared of shots. So I explain to them the muscles in your arm or wherever they're giving the shot are kind of like these fingers. They can be open a little bit like this when we're relaxed. But when we tense up because we're scared, they tighten up and they close. So where the pain is mainly coming from, of course, is breaking through the skin. You're going to have pain, but it's a lot more pain when the needle is trying to break through that. And guess what? The needle is sharp is going to win every time. So if we're more relaxed, I tell them to think about something, fun that they like, or something that relaxes them, and don't tighten up. it'll be easier for the needle to get through. So once I give this demonstration that it's easy to go through, I see a little frightened look on their face. But usually I'm coaching them through it that, you know, okay, 1, 2, 3 count, you know, shot. They don't cry. I have yet to see one cry. I did a couple of vaccinations before in the past as a school nurse, and also like helping out a colleague with a vaccine drive back to school. And school-age children, for the most part, I can tell it works, because mentally they need to see why it hurts so much. And of course, the fear that comes with it, the reason why they're scared. So I hope this video clears up some things. I hope this helps you in your next, man, you never end up in the hospital, but anything with vaccinations, you know, you may end up experiencing that. I hope that kind of gives you a more of a visual to understand what's truly going on in the sense of IVs. So leave a comment of your experience that helps. I want you guys to definitely return. I have more to come, and thank you for watching. Have a great day.